I think it's one factor, but not the only factor. Certainly, the fact that Germany has a very advanced healthcare system and a lot of capacity, particularly in terms of ICU beds, was certainly a factor. And then being able to keep the death rate down, even with the high number of infections. But there were a number of other things as well. They had very, very strong testing capacity, something they invested in early that allowed them to track and isolate cases sooner, and also did more in terms of community treatment. So there were a number of factors that led to Germany keeping its death rate relatively low compared to the number of cases and compared to some other countries in Europe.
So talk about where we are going forward as we come out of this. As you analyse the different approaches that are being taken with regard to contact tracing, masks and other measures, who do you think is pursuing best practice and where are there still question marks?
So, as you say, for us to be able to ease the kind of lockdown measures, as soon as we begin to do that and there's more mobility, if we don't do anything else, the number of cases is going to start to go up again and we risk a second surge. The way to interrupt that is by testing, contact tracing, and then being able to isolate and quarantine those who are infected and exposed to break those chains of transmission. And if you don't have that infrastructure in place, you're taking a really significant risk. A lot of the best lessons that we've seen have come from Asia, actually. And so South Korea has done a very nice job. Singapore, up until recently, there's been a surge in the migrant communities there, which has been difficult. In Europe, some of the earliest lessons are coming from places like the Czech Republic, Austria, and Norway, which had really good success in crushing the curve early and staving off kind of the worst of things. So what we're seeing is a slightly different approach in lots of different countries. It shows there's not an exact playbook for how exactly to open up. And one thing is it'll give us really important information about what works.